Now we're getting to your questions and a very important section of the show. But before we took this break, Sakina had asked if there are any medical professionals that have tested positive for COVID-19. You confirmed that there are. Yes. Perhaps maybe just to tell South Africans about that.
Well, I'm aware of three. The first one is that there's a doctor in Limpopo, but he had a travel history, and as soon as he came back, he quarantined himself. The second one was a doctor in Mpumalanga who discovered in the course of his work that he was positive. Then when he was quarantined, they actually had to quarantine a number of workmates in the hospital, and they are being checked. We had to actually partially close the hospital and fumigate it. It was a private hospital. The third one is in Free State. Here, this is a professional who works between various hospitals, does EEGs. Those are the tests which you do for epilepsy in such a situation. But we have since established a link with someone who had traveled through a cruise. So those are the three that I'm aware of. We'll keep checking. If there are any new ones, we'll be able to talk about them.
All right. Let's get on to our viewer questions now, those tweets that we asked you to send through. And we start with this one from Silindile Pagati, who's asked, where can I take my daughter for testing? She has terrible flu. Her colleague's mother tested positive, and the colleague continued coming to work. She's in Durban in Guamashu.
Oh, that one, because the colleague's mother tested positive, I think then we need to actually establish the people who did the testing. She must link up with the same people, because that means they must be taken as part of the contact tracing. So that will make it quicker. The people who tested the friend, the mother's colleague, must be the ones who must continue testing that. If we can get their number, I'll take them out and I'll deal with it just as soon as we get out of here. That means that you have got a contact who turned positive, and then we now got some of the contacts, which in this case it may actually mean even the mother could have been positive. So we need to actually close that loop quickly. So whilst I ask that they must talk to those people, I must get the details. We'll actually send a team to go and look after them.
Okay, Slindile, just DM me your contact details so I can hand it over to the minister, and he'll take care of that as he leaves here.
All right, next question. I'm going to see if we're going to put one up. Here we go. Let's quickly see that. Doesn't matter. I've got so many in front of me I can ask you, Minister. The price of the test kits. This is something that's come in quite a lot of questions that I've been getting. SCE, please ask the Minister about the price of COVID-19 testing. It's too expensive for ordinary citizens.
True.
Again, the number of those who are testing positive, don't think that number is more than what is being published for the price of the test. Let's talk about the test, and then I also want to ask you another question that's come up. You spoke about a delay, so results from 8 o'clock last night, but some people wait up to 10 days to get their results. So these figures, it certainly does appear that there is a much bigger backlog than we are aware of. So the backlog, again, if you can reiterate, and the price of the tests, can we go a free route?
Well, the backlog, you see, the test can actually, at this point, the test takes about 3 hours to do. What becomes a problem is the logistics of moving specimen from the peripheral centers to the testing laboratories. That is what might be causing a delay. And therefore, because of that, we are decentralizing. So we will hope to solve that one. The next issue, the cost of the test is very high in the private sector. So far, it goes up to about 1,400. Now, that's the private sector. The issue there is that it's driven by people who are going to private doctors. Whilst we are worried about it, we actually had a meeting last night where we're calling on all the private sector who are playing in this field, who are supplying various services. We're discussing that they must drop the price. The price has to be reduced. We can't allow anyone to profit here on a basis of a crisis. So we are going to deal with that issue. I still don't even agree with the proposed price that they are talking about, which is less than what is being mentioned now. So we want to deal with that. So all in all, in the public sector, we are still strict on the criteria. You have to have certain symptoms and contact that then we can deal with it. But because we know that in the future we're going to be getting people who are going to be having sporadic cases where no one can track the basis or a source of infection, we're going to be increasing the testing precisely for that.
Minister, how many people, a question coming from Sandy Raidu saying, how many people are currently admitted in hospital with COVID-19, worried that those that test positive are not self-isolating properly? Do we have those figures?
I don't have the figures. You'll be aware when you're talking about 700 people, many of them would be treated, all of them under the care of the doctors. So the doctors have to make a call. Not everybody needs to be admitted. 80% of the people that have got COVID-19 actually have got a mild symptom. They don't even need to be treated. Some of them, they shed their symptoms within 2 to 3 days. So if the circumstances are such that the doctors are satisfied that they can actually be treated in their own homes, they can be left under their own homes and under the doctor's care, and therefore the doctor will keep checking on what's happening with them. We're not worried too much about that because there has to be an assessment, but when the doctor is not certain that that will happen, then they take them into the hospital. You've seen some of those who have been complaining, why are we being kept in hospital? People don't like to be in hospital, but that's not the big issue. The real issue is the doctor must be satisfied that the patient will be able to successfully self-isolate. If there's any concern from the public that someone is not behaving properly, then of course it would be important. You can even report it to the police. The police can go and constrain that individual. So people mustn't fear. There's a law that will stop anyone from spreading the infection if they don't behave themselves.
This one is from Zweli Minister asking, firstly, can the Minister please publish the list of government testing places for those who can't afford the private labs, please? And secondly, I would like to hear the number of recoveries as well during the COVID-19 update.
We will publish, but the numbers are still driven by the fact that you have to go via a doctor or a clinic or a hospital. So if on the public sector, you have to go via those institutions. You can't go straight. We're not actually doing tests on demand. We're doing tests on the basis of the symptoms and conduct, and that's what we've been doing. That's why a number of people have gone to the private doctors, because they've got the history of travel, they've got the history of conduct, and then they've got symptoms. And that's why they've been going to private, because they are largely people who have got the means to be traveling and therefore go to private doctors. But if you come to the public hospital, the doctors have to actually suspect, and therefore, because of the numbers of people who have got just symptoms, they have to actually screen those that they think are most likely to be affected, and then therefore they will take them for training, for testing. There was the other question you asked.
So that was the first question. The second question, just trying to get to that one again.
Find it. I'll
it was
jump
about
in. Have you got it?
The number of recoveries.
Oh yes,
and the update on that.
It's actually an interesting debate, this recovery. We have been very conservative in talking about recoveries, because we've only just wanted to focus on those who have turned negative, who are positive. But in terms of all of those who are on treatment, most of them are recovering. Except the few that are still in hospital, most of them are recovering. But the recovery is described as clinical symptoms, the disappearance of clinical symptoms. Now, in terms of what we want to publish as recovery, we want to still stick to those who have been tested. You can actually have symptoms disappearing, but you still don't turn negative yet, so we hold you until the test is negative. So the number who have actually turned negative is 5. Okay. The numbers who have actually improved is quite a lot. I can't even keep up with them. Every day I get a report from all the hospitals, from all the provinces, how are the people doing. So I have a sense every day that a lot of them are recovering, and so the large number of the people have actually recovered. That's why we can say to you today, we know that there's no death, but also we only just, because it's earlier on in the disease, we're very conservative. We don't want to start publishing everything, because we know someone can be clinically improved. That means no symptoms, no cough, no chest pain, no fever, nothing, but they're still positive, which means they can still infect others. Yeah. So whilst they feel they have improved, but of course we still need to get the test. So we're trying to balance that up.
Quick one before we go to a break, one which is quite important, and I think, Sakina, you've got a lot on your feed as well. Will South Africa be using these American treatments? I mean, that's what El Arabiya is saying, meaning hydrochloroquine and anthracycline. I don't know, am I saying it right? And also the talk of ibuprofen versus codeine. Is ibuprofen making it worse? And these, to put it in layman's terms, more malaria treatments.
Okay.
Is that known to help?
Can I throw in another one from PEMSA there, Minister? Minister talks about treatment and we are told there's no cure. So what are they using for COVID-19 treatment?
Okay, many people don't even need any treatment. Let's understand that. And all of us who have got a virus, right now there's no cure for the virus. We don't deal with the virus directly. We just deal with the symptoms associated with the complexity of each patient's condition. We call it supportive care. Now, the first issue about ibuprofen, that's the story that came out from Italy. We have actually checked with our scientists and WHO. They say that there is no clear evidence that, in fact, ibuprofen, that is, and those anti-inflammatory tablets, that they're actually worsening the situation on COVID-19. There is no evidence, but we've seen these stories. We've got a whole team of scientists who are looking at this thing. I met with them and they're saying to me there's no clear evidence of that. The next issue is that there are various trials that have been done. Some of them are being reported to be successful, but all they are at the moment, their trials are not firmly established treatment guidelines, they are trials. So you have about chloroquine. There's been a lot of stocking of chloroquine and some were donating it and so on, and people are really going for it. But because in some of the instances they showed that there could have been improvement, that means that there's a trial that's going on and people are reading into the trial. It doesn't mean that the matter has been completely proven and closed. So at the moment we're dealing with the results from trial situation. A number of antiviral agents are being tried in China, in Italy, and they've all been dealt with. You've heard about interferon in Cuba. All of these are actually used because when there's a complexity of the infection, then doctors are allowed to try certain things, certain medication that they believe could assist. And under those circumstances, it's allowed, we can actually even license the medication for the doctor to try treating the patient under observation, and that's what is actually happening. So all of these were aware. In fact, our team, we've got a Professor Helen Rees, who's part of the WHO team that is looking into the issues of the vaccine trials and the treatment trials. So we're observing all of those, and at the moment, what we're picking up is a result of a trial in this particular case and that particular case. So it's different from an established treatment. What we're talking about is reports from various trials. So that's what we have.
Okay. We're going to take a break. When we return, Minister, we're going to throw a couple of questions at you in terms of our lifestyles, what we can and can't do. We still don't know, and I know you're not the right person, but we're still going to try and ask you.
No, that's fine.
Can we go for a jog? Are we allowed to leave our house? What time can we go to the shop? All of that stuff.
Yeah.
People are desperate.
No, those are very important questions.
We're desperate to know.
Very important questions. We need to talk about that.
But we've got to pay the bills first, so let's take a break and we'll throw those questions at the Minister.